video for anyone with lymphedema in the arm. You've had lymph nodes removed, possibly from breast cancer, and you either want to prevent lymphedema and keep the lymph all flowing, or you've got lymphedema already, you've got heaviness in the arm, or on the SOZO or the LDEX that your lymphedema physio would have put you on. Maybe your levels are rising. This is something you can do daily just to keep all of that lymph flowing. So first of all, we're going to start with emptying your buckets and getting your lymphatics all opened up. So we're going to go into that corner of just above your collarbone. I'm going to do pumps on off pressure. It's quite a gentle pressure, slow and steady, and the on is sort of downwards towards the midline of your body, and the off pressure as you come back up. While you're doing these pumps, take a nice big belly breath. That's it, about 10 times. So now go to this muscle at the corner of your neck, sternocleidomastoid, or just behind the ear. We'll start. Open up the channel that drains the head and neck. So little pumps. We're going to go little pumps all the way down, and see down that side of the neck. And the on pressure is coming down. So on, pushing down. So this is the direction of the flow. Down, down, down into supraclavicular. Okay, do that 3 to 5 times. Now I'm going to go a bit faster than you would do it, just to show you the sequence. And I go underneath the collarbones, open up the channel there. Probably I'm going a bit fast. Some nice sort of slow, steady pumps that would sort of mimic the pump of the actual lymph. Okay, on the mediastinal nodes and just above the sternum. Again, a little bit of a downward pressure on the on pump, and the off you just release. Again, some nice breaths. Now pumping underneath the armpit. It's a little cave in there, so you squeeze in towards the midline of the body on the on pressure. Off is just the release. Again, nice breath. Squeezing all those deep lymphatics in your belly with your diaphragm. 5 to 10 times each side. Even though you may only have one affected side, do both sides. Okay, and then just at the corner of your sort of pec muscle there, all over the shoulder, a few little pumps there, each side. Okay, and then you're going to do some belly breathing. So you've got just underneath your sort of rib cage there and there. You can do them at the same time, really. So just taking some nice big breaths, breathing in, resisting against your pressure. Breathing out, following your hands in. Breathing in, resisting against your pressure. And out. Now either side of your sort of hip bone there. Breathing in to your hands, resisting slightly. Breathing out, following the pressure with your hands following it in. Again, breathing in, pushing against your hands, and out, pushing in. So you do probably that 3 times in each station. You can do it one at a time if you find that easier. Okay, and now you're ready to do the lymphatic. So this is like, as I say, a lot car park full of cars. None of these cars are going to go anywhere unless these cars have been moved from the only exit. So even if you've had lymph nodes removed here, it's still going to drain here and up to the collarbone. Okay, so you start proximally. So the actual, you need to do it on straight on skin. Okay, so the actual lymphatic drainage stroke is quite slow. It's more of a skin drag, so you don't use any creams. Do all around, do 3 strokes in each place. Straight down to the axilla. Okay, moving downwards, but always moving towards the heart. So I'm taking my hand completely off and always the stroke is only coming towards the heart, okay? So 3 strokes in each position, bringing it up to the axilla, every now and again having just another little pump, another little breath, another little pump, another little pump. Okay, so then you're working your way down. Have a little pump inside the corner of your elbow there, some lymph nodes there, in the inside of your arm. Okay, always moving towards the axilla. Okay, now moving. If it gathers around your elbow, then, you know, do a bit more time there. Squeezing around the elbow, squeezing up the hand. Now, if your swelling's only in the upper arm, I wouldn't spend a huge amount of time in the lower arm. I would still do it. But, you know, this is just to sort of keep it all moving, keep it all flowing. But if you've got any swelling in the hand, in the forearm, in the wrist, make sure you spend more time on where there is swelling. But you do need to open up. If the swelling's only in the arm and the forearm and the hand, you still need to open up the channel in the upper arm to get all of that moving, all that lymph moving before any of this will move. So spend more of the time softening and dragging on where there is actually swelling. Okay, if it's quite firm, you know, you can do then a little bit of a kneady. So now I've got firm tissue often gathered showing the inside of the forearm. Can do a little kneady pumps there. But again, my on pressure is coming up towards the heart, okay? I can feel all my bubbles and gurgles in my tummy, which means I'm moving my lymph, which is a good sign. Okay, so then your hand, dragging down the metatarsals there of your hand, dragging down each finger. Again, I'm going much faster than I should be. Really should be like a slow, that's the sort of speed of the lymph. You know, slow, relaxed pressure, okay? Squeezing down the palm, squeezing down the thumb. And then you work your way back up. Always going towards the heart, working your way back up, all around the arm, the shoulder, and come up, back of the arm, up to the nodes at the back, all around to the collarbone again. The shoulder, bring it all around to the collarbone, over the chest. So if this is quite compromised and you've had full clearance, I mean, it's still going to go to deeper channels, but, you know, carry the stroke on, bring it up there, a bit of a pump, but carry it on. So if it is compromised, it's got somewhere else to flow up into this collarbone, okay? Finishing with the same pumps that we started with, the same breaths, supraclavicular, subclavicular, mediastinal, axillary, deep breaths, neck, behind the ear, bringing that down, and then the breathe in again. Okay, so it should all just take about 10 minutes. Good to do if you've got lymphedema, good to do every day if you can. If you don't, you're just preventing it, then once or twice a week would be great, you know, just while you're watching TV, you know. Just give yourself a few little breaths, a few little pumps, a few little strokes, really easy. So give it a go. Okay, thank you.